It is indeed a matter of great happiness that we are today launching the media plan and also talking about the new strategies which we are adopting to end TB and go in an aggressive manner so that we are able to address this challenge. Being the World TB Day, my colleagues have spoken on various issues. It is happy to note that India and the Health Department has taken a very optimistic approach and also aggressive approach when we are talking about ending TB in the SDGs by 2030. We plan to do it in 2025. Recently also we had a meeting with neighboring countries' health ministers, where we also came out with this strategic plan. We also shared with them, and we came with a commitment that we'll be ending tuberculosis by 2025. The TB control program is one of the world's largest TB control program, which we are taking, and of course we have to learn through our own experiences, and that we have done from time to time. Once we were working with the DOT program, and then we went for the daily regimen, and for that also we have changed our strategies from time to time to see that how aggressively we can fight out the tuberculosis. One very interesting part is that we started last year was the active case finding, and that was door-to-door finding of the cases, going and reaching the people. That we did in 50-odd districts. This year we plan to do it in 130 districts, the high-risk areas. So, and last year we experienced that the case registry had increased by 5%. And this year when we were going to go for active case registration and from door-to-door program, the surveillance program, we also feel that there will be a rise in the registration of the tuberculosis cases, and all those have been put on treatment and will be putting on treatment after this 130 districts this year when we will take up. So I think that this is a very important step which we have taken, and it's going to help us out in this program, in this addressing the disease. As I said that last year we have rolled out in 5 states the daily regimen, and now this year we are going to roll out in the whole country. So practically every state will be taken in this program. As far as the detection part is concerned, practically now every district has got CBNAT machine. Last year we arranged 500 CBNAT machines, and that is also a very important step in getting the patient detected, and that too at a faster speed and without any difficulty. So that we have done. We have introduced the new drug bedaquiline, and it is very helpful to see to it that we are able to address this program. We have just now seen the IT-based Nikshay program, which is going to help the private practitioners in making the case registered and helping the registry. So these are the initiatives which we have taken. Prime Minister himself is committed, and under his guidance we have been working. He has spoken on tuberculosis in Man Ki Baat also, and he has also taken a review in the Pragati meeting. Pragati meeting is a very important meeting which takes place, which is chaired by the Prime Minister, and he takes review of the programs. So he has personally taken that Pragati review of tuberculosis, and we are working in that direction. New issues have come up. I was told, as Henk Bekdem has said, that we should go for a coordinated plan. Very correct, we have to do it. A good suggestion has come about Plan A and Plan B, but this suggestion came from the Secretary Health. Yes, we should think about to reach every person, what Plan B should be. We should think about it, and we should make it more practical. One thing I can give a commitment is that the Government of India is committed to see to it that by 2025 we will end tuberculosis. So I would request that on the initiative of Ministry of Health, Secretary Health has taken that initiative, all the development partners and the stakeholders and the civil society people, let us think afresh, because this will not be possible in the normal strategy which we are following. We have to think little different, and we have to be very, very, very aggressive. As far as the finances are concerned and the political commitment is concerned, it is unquestionable. We will take care of it. No financial cut or shortage will be there. Not at all. We will see to it. And as it is, I would like to say very clearly about it. When I talk about finances, when I joined as a minister in this ministry, people were talking that there is a slash, there is a cut, things like that. But I told them that it is not the case. The Government of India is committed for health. The new health policy has come. Now we have committed ourselves for 2.5 of the GDP will be spent on health, and we are going to go forward in that direction. The most important thing is that it is the absorption of the utilization of the funds. This year, last year, the budget was to the tune of 37,000 crores. This year, it is plus 47,000 crores. 10,000 crores extra, 27.7% increase is there in the health program. So that is not the issue. Issue is that we should increase our capacity to spend that money and see that the rightful utilization is taking place. Initially, the budget estimates was always, the number was more than the real expenditure. It is for the last 2 years that the budget estimate is less and the real expenditure is more. And the expenditure is to the 99%. That is how we are working. That means the actual expenditure is much more than even the estimates which we have been estimating in the budget. So finance is not the problem. Any program which we are undertaking, last year we introduced the program called as the Pradhan Mantri Dialysis Yojana. You will be happy to note that at least 10 lakh patients, 1 lakh patients have been treated. Free BPL dialysis have been given to them, and more than 900 crores have been spent on this program. We have kept it. So that is not the problem. Problem is how do we go in an aggressive manner and strategize. As Secretary told that we have to develop a program which is doable. We have to be pragmatic. We have to be practical and see to it that how we can involve everybody, synergize, and see to it that in reality we are making change at the grassroots level, at the level where we are eliminating the disease. So once again, I stand committed, the Government of India stands committed that we have to end tuberculosis. The strategies, changes, or whatever is needed, I would request the Ministry of Health to initiate this, and along with the development partners, we should re-strategize to make it a reality. That is what I'd like to say. Thank you very much.